A teenager is sitting in a classroom when a sudden surge of terror takes over. Within minutes, their heart is pounding against their ribs, their chest feels painfully tight, and a powerful sense of impending doom convinces them that something is terribly wrong. Their immediate reaction makes total sense: a frantic trip to the school nurse or a rush to the local emergency room. But when doctors run an EKG and check their vitals, they find a puzzling result. Structurally and medically, everything is completely normal. It is common for adults to mistake these moments for teenage drama, but the chest pain, the shortness of breath, and the trembling are entirely real to the patient experiencing them. What we are seeing is the body manufacturing a deeply visceral, physiological response. It is triggered by a sudden surge of intense fear, rather than a hidden physical illness. Once the initial episode ends, a new, quieter threat moves in. A persistent, agonizing worry about exactly when and where the next attack will strike. This anticipatory fear acts like a vacuum, pulling them away from daily life. The student starts avoiding any location they associate with the panic, which very often means refusing to go to school. This is the clinical threshold for panic disorder. To make the diagnosis, a licensed clinician looks for exactly this pattern: recurrent, unexpected attacks paired with a persistent, life-altering worry about having another. A diagnosis does not come from a fast heart rate alone. It comes from the debilitating pattern of fear and avoidance that the panic leaves behind. To understand why avoiding school exacerbates the condition, we have to look at how panic disorder operates. It functions as a strict, self-reinforcing behavioral loop. This diagram outlines the 4 stages of that loop. It starts right here in stage 1, with the unexpected panic attack. That sudden terror feeds directly into the second stage, an intense fear of the next attack. To cope with that fear, the student moves to the third stage, avoidance behavior. They skip a class, drop out of a social event, or stay home entirely. While staying home offers temporary relief, it completes the circle by pushing them into the fourth stage. Their long-term anxiety spikes, priming their body for yet another unexpected attack. This creates a neurological trap. By avoiding school, the student actively reinforces their brain's false belief that the school environment is inherently dangerous. You cannot simply wait for the panic to pass. To cure the disorder, a patient has to actively intervene and fracture this self-reinforcing loop. The primary tool clinicians use to break this cycle is cognitive behavioral therapy, or CBT. Within CBT, there is a specific, highly effective technique called interoceptive exposure. Interoceptive exposure requires the patient to gradually and safely face their feared bodily sensations, always under the strict guidance of a licensed clinician. In practice, a therapist might have the student do a few minutes of jumping jacks. This intentionally induces a harmless, elevated heart rate in a controlled setting. The therapeutic goal is straightforward: teach the brain that a racing heart is just a physical sensation, not a sign of impending doom. And when clinically indicated, medication can also be used alongside this exposure to help manage the process. By repeating this, interoceptive exposure recalibrates the brain's threshold for fear. It treats the root psychological cause instead of merely managing the physical symptoms. But this creates an accessibility paradox. If a student is suffering from severe avoidance, the simple act of leaving the house to see an outpatient therapist is an immense, sometimes paralyzing hurdle. The systemic solution to this hurdle is to bypass the commute and bring the clinical care directly to the student. That is exactly what MentalSpace School does. Looking at this network map of Georgia, we can see MentalSpace School's core service model in action. They provide K-12 mental health support across the state, connecting a centralized clinical team to schools and homes through same-day teletherapy and family counseling. Crucially, this care is designed to be accessible. The service is fully HIPAA and FERPA compliant, is in-network with most major insurances, and costs $0 for students covered by Medicaid. Panic disorder can make a student's own body feel like an enemy, but by combining targeted interoceptive exposure with accessible, school-integrated support, teenagers can permanently break the cycle of avoidance and reclaim their lives.